Thank you, Mr. Speaker. At the heart of this 2026 budget is a simple but powerful belief. When families are supported, the nation is strengthened. This budget is not written only in figures and projections. It is written in school uniforms, school lunches, bus fares, in water and electricity subsidy, in house lots and turnkey houses, and in the quiet belief of parents who know they can depend on the People's Progressive Party civic government to breathe a little easier. This government says clearly to our people, and I say this to you out there, we see you, we hear you, and we are standing with you. Mr. Speaker, on the 1st of September 2025, the People's Progressive Party went to the polls and the people spoke clearly and decisively. They returned the People's Progressive Party to office and re-elect His Excellency President Dr. Muhammad Irfan Ali for the second term. They entrusted the PPP Civic with 36 seats in this honorable house because they believed in our leadership, our sound economic management of our country's resources, and our commitment to improving lives across Guyana. Their vote, sir, was a vote of confidence, not no confidence, a vote of confidence. Confidence that this government understands the realities facing everyday Guyanese and remains committed to the people-centered policies. Mr. Speaker, I would like to join my colleagues to congratulate the Honorable Dr. Ashni Kumar Singh, Senior Minister in the Office of the President with responsibility for finance, on his more than 6-hour budget presentation under the theme, Putting People First. It was a comprehensive assessment of our economic performance and our clear roadmap for the next 5 years, grounded in growth, resilience, inclusion, and sustainability. And all staff across the government, I would like to say thank you for a fantastic job in providing the data for budget 2026. Mr. Speaker, this budget, you know what Basdev Pandey said, former Prime Minister of Trinidad? When you stick to your speech, you get your thoughts across properly. Mr. Speaker, this budget reflects once again the People's Progressive Party's civic philosophy of development with a human face, as articulated by Dr. Cherry Jagan in the new Global Human Order. It is grounded in the National Development Strategy and the People's Progressive Party Civic Manifesto of 2025. While macroeconomic stability is essential, true success is measured by how policies improve the lives of our people, women, children, the elderly, workers, vulnerable households, etc. Mr. Speaker, let me start my argument by how this budget treats family as a basic unit of development. You are aware, sir, that most of our people lived in extended family households with parents, children, grandchildren, and sometimes relatives sharing responsibilities together. Sir, every program in this budget benefits families across all strata of society. So let me begin with our children and families, because investment in children is an investment in Guyana's future, because our youths of today will be our leaders of tomorrow. Sir, since January 2025, every family is given a cash grant of $100,000 at the birth of their child, easing the financial burden on new parents and giving them a stronger start. Sir, it doesn't matter which hospitals or which part of Guyana that child takes birth, all benefits. Mr. Speaker, the PPP Civic believes that when we invest in our children's education, we invest in Guyana's future, as I said before. In 2026, approximately 208,000 children will benefit from public and private schools. From public and private schools will receive $60,000 cash grant, $5,000 uniform allowances, and $20,000 in transportation allowances, a sum of a whopping $8,000 to $5,000 per child, putting in an excess of $12 billion or more in disposable income in the pocket of our people directly, sir. This is not a symbolic gesture, sir. This is real money going directly to families, helping parents prepare their children not just for school, but for success. Mr. Speaker, we rarely hear critics of the PPP civic government acknowledge the benefits and impact of education in Guyana, which is free from nursery to university, or that textbooks are provided to children through the Ministry of Education, or how the Ministry of Health, through its health vouchers, have successfully benefited many children with eye testing and spectacles, or that general medical screening exists for students nationwide. Sir, these are meaningful, practical support, easing pressure on parents, improving school readiness, and ensuring that our children are in good health and that no child is left behind. Mr. Speaker, this budget also recognizes that families are not supported by children grants alone. Budget 2026 catered to several other initiatives to ease the burden on families, caregivers, and workers. Sir, I would like to remind you that this government, in the first 100 days after it took office in 2020, removed VAT from more than 200 essential food items, including food supplies, school supplies, medicines, medical supplies, water, electricity, and data. These were all returned to zero rated. Taxes were restored to 2015 levels, and we have all benefited. These were promises made and promises kept. Sir, we are excellent at keeping promises made to our people. Sir, removing VAT has directly reduced household expenses, easing financial strain, and returning billions of dollars annually to families, especially benefiting women-headed households, senior citizens, and low-income earners. Mr. Speaker, National Cash Grant. Mr. Speaker, when you go around the country, you hear a lot of critics saying cash grant is a waste of money, yet you can see these very people in the lines going and collecting this $100,000. Why don't they reject it? Why do they collect it? This initiative started in 2025, which put immediate resources into family budgets to pay a bill, buy food, invest in small business, or simply manage day-to-day life with dignity. This, sir, will put approximately $60 billion back in disposable income into the family pockets again, as it did in 2025. Sir, when we talk about the income tax threshold, we make it look like if government is doing something very, very paltry for people. But let us look at some data here. Between 20 to 2025, the threshold increased by 100%. Because when we got into government in 2020, it was only $65,000. And we took that to $130,000. And this year, we're taking it to $140,000. It is interesting to note that when APNU left office, they had only $60,000 a month. But we did double that and add more to it. So that is what we could have done, but we can do better now, and we are doing it. Mr. Speaker, women's empowerment agenda remains pivotal to government's development agenda. We recognize that women hold up half of the sky, and that our country cannot experience real development if our women are left behind. Indeed, sir, the Sustainable Development Goals remind us that true progress can only be achieved when no one is excluded, and when women are fully empowered to contribute their talent, leadership, and innovation. To leave women behind is to leave half of our nation's potential untapped. To uplift women is to secure a future of dignity, equity, and sustainable growth and development for all. Mr. Speaker, we have gone so much farther than the Sustainable Development Goal would have asked us. We created jobs for women across Guyana and men. under the program called National Pathway Workers Program. This was launched in 2022. And by 2020, we created jobs for over 18,000 people, of which 67% were women. And on the 2026 budget, from $40,000 in this budget, the pathway workers across Guyana will be given an increased stipend of $10,000, taking it up to $50,000. Sir, when we Guyanese are encouraged to pursue training through Coursera Gold scholarships on the Board of Industrial Training or the Women Innovation and Investment Network, we are telling our people and our women that, look, these are programs to strengthen your pathway to long-term employment and financial independence. We are saying gold scholarship to reach every household and that everyone is encouraged to apply. And then those who did not have the opportunity, sir, to complete secondary school, they have the opportunity on the goal to do remedial courses that will take them straight to their degree or even master's or doctorate. And sir, of that 54,000 persons that were trained on the Gold Scholarship, 70% of the beneficiaries are women. And sir, this is what the People's Progressive Party is doing. It is not leaving the children behind, nor leaving the women behind. We as a government, we uplift people and we bring them along because we understand them. Mr. Speaker, when the PPP civic government when we came to government in 1992, after 28 years of PNC dictatorship, we found that there was no ministry dealing with housing issues. And up to that time, sir, women hardly owned any property. As soon as we got into government, we set up the housing ministry. And sir, we ensure that every family that applied for a house lot, the names of women were included on those titles. And that is how we ensured that women had stability in a family. Sir, between 20 to 25, more than 50,000 house lots were allocated, with approximately 47 to 50% of those allocations went to women. And sir, Mr. Speaker, I was taught that since childhood, a piece of land is the thing that grounded people, and it motivates them to put down a structure and to build on that structure and make it bigger. And it provides foundation for a family. Sir, this underscores the housing drive role in advancing the Sustainable Development Goal 5 under gender equality, and also the SDGs 11, Sustainable Cities and Communities. So, sir, we are not only working in Guyana to achieve these objectives, but we are meeting deadlines by the SDGs or the United Nations. Sir, our government has allocated a historic $161.1 billion to the healthcare sector, building modern hospitals, expanding digital healthcare, and training of thousands of medical staff, including nurses and doctors. This investment will ensure that every Guyanese throughout Guyana can have access to modern healthcare in line with the SDGs. Sir, our government has already commissioned 6 of the 12 regional hospitals, bringing modern healthcare closer to thousands of Guyanese families. These include Lima, Bikendren, and more, Diamond, Bath, and number 75 Village in the quarantine. In the next few years, the other hospitals will be completed while many health centers will be upgraded and renovated. Sir, the Maternal and Child Care Hospital represents a new era in women's health in Guyana. It will provide specialized care to women during pregnancy, reduce maternal death and infant mortality, and ensure that every mother, whether in Georgetown or the hinterland, can deliver her child with dignity, safety, and hope. It is expected that over 10,000 mothers will benefit from specialized care in these new hospitals every year, something women look forward to with great anticipation. Sir, many health centers are becoming polyclinics, like the one in my community. All these facilities will have doctors, nurses, and pharmacists, etc., catering to the medical needs of our people. Many of these health centers are becoming polyclinics, and they will have specialized services to patients. Sir, as reported time and again by our Minister of Health, these hospitals are provided with CT scan machines, ultrasound machines, heart machines, and some will have dialysis machines soon. And the Georgetown Hospital, having a new MRI machine, will ease the financial burden on ordinary or vulnerable families. Sir, Mr. Speaker, I would like to remind you of the Ministry of Health introduction of the HPV testing vouchers.
To remind me further, you need an extension.
Speaker, I move that the honourable member be given 5 minutes to conclude her presentation.
Thank you very much, Minister. Honorable member, you may
Mr.
conclude in
Speaker,
5 minutes.
families do not exist in isolation. Many families live in multi-generational homes caring for their elderly parents and sometimes grandparents. This budget also responds to this situation with compassion. Old age pension increased from 20,000 to 41,000 between 2020 to 2025, and it will further go to 46,000 this year. Sir, when we talk about the elderly and we grumble that the elders need more money, we forget that it was the opposition, the coalition in opposition, that took away the subsidy for water and electricity, and we have restored that. We forget that all the food items, medical supplies, medication were VATed, were put 14% VAT on. We remove all of that, and we have made life much easier on these persons. Plus, sir, the health vouchers have assisted a lot of elders to get their eyes tested and get a $15,000 to help them to purchase a spectacle. Sir, we have done quite a lot to ensure that our elders are provided for. Sir, the PPP civic aims to empower families not with promises, but with practical support, not with slogans, but with tangible relief, not with charity, but with dignity. This budget that meets people where they are in their homes, their schools, their workplaces, and their communities. This is putting people first. Mr. Speaker, that is why the 2026 budget truly deserves to be called a people-centered budget. One that invests in projects for the vulnerable, for the family, and for the individual, no matter which part of the country they belong to. Sir, taken together, this budget reflects a government that governs with purpose, compassion, and responsibility. It speaks to parents striving for their children to women balancing household and work, to senior citizens who deserve dignity, and to young people seeking opportunity. It speaks about a government that put people first by ensuring that every program outlined will improve the lives of our people. This budget provides hope of a future that we can be proud of, and one that we are working together to build for the next generation. It speaks to a Guyana where all can be educated and all can find a job, all can own a house, and all can look forward to a future that is filled with hope and prosperity. Sir, under His Excellency Dr. Mohammed Irfan Ali at the head of the government and Dr. Bharat Jagdev at the head of the PPP, with the stewardship of Honorable Minister Dr. Ashni Singh, this young group of ministers will continue on a path of an inclusive growth and shared prosperity. Guyana, sir, is in very, very good hands. Mr. Speaker, I fully support this budget and commend it to this House for approval.